graduated from Perez, and I graduated about 4 years ago. So I'm going to be doing a presentation, just like a general overview on what community pharmacy is. This is like a subversion of what general pharmacy. So there's so many different fields in pharmacy, but I'm going to be talking more specifically what community pharmacy is, especially because this is the field that I work in and that I always knew I wanted to be involved since I was even before in pharmacy school. So hopefully I can give you guys some insight, some information, education points on what to look for, what to expect, and the way the field is changing as well. So with that being said, I'm gonna go ahead and share my screen. I do have a little presentation on PowerPoint, so let me get that uploaded for you. All right, so I do have it uploaded. Hayden, by any chance, are you able to see the PowerPoint presentation? Just want to make sure it's good to go.
Yeah, you're good to go.
All right, thank you. All right, so let's get started. So again, what is community pharmacy? I'm gonna go ahead and give you the table of contents on a little bit of what I'm gonna be discussing today. So I'm gonna do a little bit of background on my personal background, just to give you some information on where I came from, essentially my journey, do some definitions to distinguish between different fields within the pharmacy and the community setting, looking at scope of practice. So this is actual day-to-day duties and workflow that we do. Look at some statistics. So I know this is important to know, from everything from salary to even the percentages of pharmacists that go into this field. I'm going to talk about a little bit of careers within this field as well, to kind of give you guys an overview, the different options that are available. Talk about the future from what I'm seeing now, from everything that's been changing, and look at the impact that KGI had on me on the within the pharmacy, and then do a little summary, and then we'll do some Q&A if anyone has questions. So we'll do that at the end, okay? All right, so here's a little of my background. I am third generation Mexican American. I was born at the Queen of the Valley Hospital in West Covina, so not too far from KGI in the San Gabriel Valley. I grew up originally in Baldwin Park, so not too far as well. I'm not sure if anyone's familiar with atopic triad. It sounds scary, but it's essentially what it is. It's 3 different diseases that are inflammatory based. So you have asthma, which is a breathing lung condition, eczema, which is skin, and then you also have just basic allergies to like the season, or even like dandruff or cats and dogs. So a lot of these diseases are tied to one another. And so when I was growing up, these are the 3 that I had to deal with, and still a little bit today, but not as much when I was a kid. But the reason why I bring this up is this is actually my introduction into the medical pharmacy field, because I was always around different providers, pharmacies, urgent cares, hospitals. I mean, I was in and out all the time since I was a kid. So that kind of gave me my introduction into the field. And then from there, it just kind of sparked my interest into learning more. And then that's kind of how I got my my initial decision to go into this field. In high school, I moved to Chino Hills. So I graduated from Ruben S. Ayala. And then I went straight to Cal Poly Pomona. So again, I've been staying pretty local throughout my journey. So I got my bachelor's degree in biotechnology, and then I also double minored in chemistry and marketing management. And then in 2018, I was privileged to be part of the inaugural class of KGI. So I entered in 2014. Once I graduated from Cal Poly, I entered in 2014 to KGI, and then I graduated in 2018. And I got a certificate in NTO, which I'll discuss a little bit with KGI. They have these different certificate programs within the pharmacy curriculum, but I chose medication therapy outcomes. So I'll go a little bit more into details about what that entitles. But that's kind of my background, just to kind of give you an idea of where my journey started. So then once I graduated from KGI, you know, of course, everyone wants to get a job, right? You want to work. So during my P4 year, what they call essentially is just your 4th year in pharmacy school. So during that time, a lot of students are on rotations, they're getting ready to graduate. So a lot of us have jobs lined up. So I essentially was a intern for Walgreens. And what I did was I floated throughout different regions in the Coachella Valley. And for those that are not familiar, Coachella Valley is essentially the Palm Springs area. So anywhere from Cabazon, Palm Springs, all the way out to Indio, Coachella. And so that's the area that I was hired for. And so I floated out there as an intern. Once I graduated, I worked in that area for another 2 years, just kind of going wherever they needed me and filling in for other pharmacists, just to make sure I get my hours. And then after about a couple of years, I was finally able to get staff, which means get settled in one location, a little bit closer to home. And that is in the city of Cali Mesa, which is out here near Redlands, Yucaipa, Beaumont area. So it's a little bit past Redlands. And so once I got staff, I was essentially the second pharmacist there. So we had the manager and then we had the staff. So I was the staff. So I was able to get a consistent 40 hours, one location, no more floating, a more set schedule. So that's kind of how my pharmacy journey started. And then just this year in January, I got hired with the Indian Health Services for the county. So Indian Health Services provides services for the Native American population in the Riverside, San Bernardino County out here. So I work as a float pharmacist again, but I am guaranteed full-time. So I rotate between the different sites here. And I'm not sure if you guys are familiar with some of these names, but you have Morongo, Soboba, San Manuel, and Pachanga. So all these sites are affiliated with the casinos. So I don't work at the casino, but all these casinos are on reservation lands or near reservation lands. And then each of these lands have a clinic for that population. So I rotate between these sites. So it's kind of neat to kind of float around and see these different locations, but that's where I currently been for the past 6-7 years now. I was married in 2017. I have 2 young children now, so it's been pretty busy time for me. My son is about to be 2, so he was born in 2020, and my daughter was born in 2021. So his name is Isaiah, her name is Leah, and I just got our first home this past year as well in Beaumont, which is out here again near Cali Mesa, Cabazon area. So I can kind of provide you all this information because I think it's important to have a little bit of a tying your personal and your career background together. So with me, I've always wanted to have a family and work close to home. And so I think it's important to keep that in mind anytime deciding to choose a career. So this was my journey, and now let's kind of get into some of the definitions. So when it comes to pharmacy or anything in the medical field, you're going to hear 2 terms a lot, and they're pretty much the basis of what field you go into. So you're going to hear outpatient, and then you're going to hear inpatient. So to kind of make it easier, some of you may know already, but I'll go over briefly. Inpatient essentially means you're a patient within a hospital setting. And by definition, you have to be admitted for at least 1 night. So you have to stay overnight and you'll be considered an inpatient patient, if that makes sense. Outpatient just means you're being treated outside the hospital. So if you go into the hospital for something and you're there for a few hours and they let you go, or what they call discharge, and then you need some medications to treat your symptoms. So even though you're not in the hospital, you might have some symptoms that need to be treated. This is considered outpatient. So let's say they give you a prescription and then you pick that up at your nearby pharmacy of your choice, and then that is considered an outpatient setting. So I'm going to be talking more with outpatient because the community pharmacy is within the outpatient setting. You'll hear a lot of definitions used interchangeable, and it could be a little confusing. So I'm going to try to break it down, make it easy as possible to know the differences. So that way, if you guys are ever interested in the pharmacy career, you have a better understanding of what field and what route to go to depending on the setting. So that's the main difference between the 2. So since we're going to be talking about outpatient, there's some more definitions within that setting that kind of break down. So one that you will hear a lot too is retail pharmacy. I think this one is pretty common with a lot of people because pharmacy isn't just retail, but you have retail stores and things like that. So within the pharmacy, retail, essentially we focus more on like chains. So you have your CVS's, your Walgreens. Community pharmacy, by definition, has the same meaning. It just talks about being in a setting outside of a hospital. So you'll hear community and retail be used a lot, interchangeable. So, if you look at the definitions, they're used a lot. When you're in the pharmacy field, we tend to not use them as interchangeable because we think of retail as more of the chains, where community will think more of it as maybe like an independent or like an outpatient clinic. But yeah, so retail, community, by definition, you'll be used interchangeable. But again, if you're in the pharmacy setting, retail is usually more chains and community is more non-chains, if that makes sense. And an independent is more in the pharmacy like owner base or like multiple business owners. So this is more independent. So if you work in independent pharmacy, technically it's still a retail setting, right? You're providing services to the public, but we don't really call it a retail pharmacy because you're independent. You don't have the same rules apply as to maybe like a corporate company in that sense. So if that kind of makes sense, that's kind of what I'm trying to point out is to distinguish between retail and then other non-retail settings like independent. And I'll go more into other options and other fields that are not retail, but are still kind of community outpatient based. But this is kind of the point of my presentation, is to kind of give people an insight of the differences. Because when I was an undergrad, before I went to pharmacy school, I always thought you had retail pharmacy, so you work at your local pharmacy, or you worked in a hospital. And that was kind of the only thing I knew. And then of course, as you start doing more research and learning about pharmacy, there's so many different fields that are growing and expanding. So within the community setting, there's so much more than just working for your retail chains. So that way, if you're interested, you have those options aware. All right, so scope of practice. So this is essentially our day-to-day activities. I would say with community pharmacy, the first bullet point here regarding counseling and communication skills are very key because you're in the everyday face-to-face on the phone with the public constantly. So essentially anyone can walk into your pharmacy if you're in a community setting and ask you a question, call you, verify medication, side effects. So, other settings, it's a little bit different. I've never worked in a hospital or anything like that. I did some rotations, but it's definitely different where you don't have that everyday patient interaction. You may do rounds where you go around the different floors, but here in the community setting, you'll have patients coming up to you all the time, asking you questions. And so you need to have great communication skills because you're essentially trying to transcribe the information of these medications, the drugs, mechanisms, side effects, and you're trying to translate it into a way they can understand you. Because it's not so much of what you know, but what you can essentially translate to them. So when they go home, they follow proper directions. And so, of course, we also dispense drugs, provide clinical services, which I will hit on a little bit more details what that is. Storage handling. So we have to be in charge of the medication, making sure they're in the right temperature and, they're not going to be, expiring soon or anything like that. Documentation, understanding insurance coverage is another big one within this field because you're constantly working with different patients from different settings. So they have different insurances. So you have a lot of patients who, need coverage and you need to help finding, what is covered. Sometimes what they call formularies, which are what insurances have a list of drugs that they cover. And patients don't always know their formulary. So when it comes to the pharmacy, that's where we have to help and try to educate and explain to them, what is covered, what is not, based on what the insurance is telling the pharmacy. So things like that. Of course, we're always promoting health, especially in the community setting. So that's important. And then also understanding policy and procedures. So this is just more general in pharmacy. All right. So kind of hitting on some of the clinical practices that we do. So in the community setting, you have a lot of vaccines that are provided. And especially these past couple of years, it's been pretty hectic, especially just with COVID alone. But on top of COVID, we do flu, pneumonia, hepatitis A and B, Tdap, which is your tetanus or your whooping cough, and shingles. So these are most of the vaccines. There might be more or less offered depending on the location or the site. But if you're working in a community setting pharmacy, you're going to be most likely doing a lot of vaccines, which is great because you're providing a service for the public and patients that might not be able to make an appointment with their doctor. So it's really convenient for them. And then especially in a lot of the community settings, the hours are pretty expanded. So that also helps them as well. MTM is a term, stands for medication therapy management. And what this is trying to help patients stay adherent or taking their meds as they're supposed to, so we can keep them out of the hospital or from any harm. So what they do is they try to follow up on patients or on diabetic medications, maybe blood pressure, cholesterol, a lot of these main chronic conditions. And we try to follow up with them, make sure they're adherent. So they'll have programs within certain companies. And again, each company is different or setting, but essentially what they're trying to do is follow up with patients, make sure they're adherent, taking their medications, make sure they're picking up on time. And if they have any questions, we try to follow up with them to see, the reason why they stopped taking it or their concerns. And this is essentially MTM. And the main goal with this is to reduce costs and hospitalization in the long term, because it's so much cheaper to dispense, medications to patients than for them to be admitted to the hospital, which can be a huge cost for the hospital and healthcare setting. So that's MTM. So you do a lot of this depending on your setting, but kind of get used to being interactive with patients, as I mentioned, because like I said, pharmacies changed a lot in the past 20, 30, 40 years. We weren't doing vaccines, 40, 50 years ago. So now it's a main thing that we do. And so now MTM is a big one that's growing now. So a lot of pharmacists are doing, educating and consulting on that. So just things to keep in mind about pharmacy, especially in the community setting. Some other tests that they have. So for example, when I was working at Walgreens, so you have your vaccines and you have your testing that you have going on. Blood pressure is a thing that we also provide. So most pharmacies might have a little machine on the outside where you can do your own blood pressure testing. Some of them, like the Walgreens I worked at, we have to call the patient in, fill out a little form from them, and then do it for them, put the machine around their arm. We also do glucose testing, cholesterol testing. So I've never done those specifically, but I know certain pharmacies, again, if you work maybe like an independent, they might provide these services. So it's good to be familiar and have that education awareness. COVID-19, we did a lot of that testing at Walgreens. So, we utilize the drive-through, especially with, using non-contact. And then TB skin tests, again, certain pharmacies might do this, but this is essentially testing a skin test on your forearm for tuberculosis. So these are just examples of what they call POCT, which is point of care testing. And again, this is something that I see growing a lot because a lot of people have access to pharmacies in the community setting. So they're starting to implement a lot of these testing for them. So then you have your over-the-counter testing. So even though you may not work with these tests directly in your pharmacy, a lot of patients are going to ask you about these testing. So you have, your pregnancy tests, you have some HIV testing. A lot of people will, try to buy drug screen kits, for maybe their son or whoever in the family, and they're going to ask you questions like, hey, I'm trying to test for, let's say, a hydrocodone, which is generic for Norco. So we have to be familiar, okay, well, hydrocodone is considered an opioid. So when you look at the test, you got to look for opioid, because it's not going to tell you, oh, we test for Norco. It's going to just give you the general class of medication to test for. So just being familiar with that is important. And that's something, again, that, you don't really learn about in pharmacy school, but as you start working, you start to be more familiar with these tests. Because again, you're the point of contact with a lot of these patients. Sometimes they're coming in at 7, 8 p.m., 9 p.m., depending on what time the pharmacy closes. I work overnights in Walgreens for essentially graveyard shift, and I'm the only person in the pharmacy. So a lot of these patients sometimes will come in overnight, ask questions. So I have to be, knowledgeable on these products, so I can give them the proper education. Compounding is another one that's pretty unique. And what it is essentially it's just customizing medication for patients, or actually pets too. So what they do is if a medication is not in a certain form, what they do is look into a recipe and see if they can maybe break it down into a liquid, or if something is liquid only, can we put it into a capsule? And they try to customize it for patient needs, depending if a patient maybe can't take pills, or if they, can't swallow, they try to find different forms for them. So a lot of independent pharmacies might offer this service. One Walgreens I worked at actually did compounding, so I got to do a little bit of that. Pets is a big thing, because a lot of pets, obviously, right, you can't give them the same dosage as a human. So you compound it to the dose that's appropriate for them. And then I remember when I was in undergrad at Cal Poly Pomona, there's a pharmacy school called Western, not too far from KGI. And I used to volunteer at the pharmacy there. So they have a little patient care pharmacy. And I used to volunteer there for about a year or so. And I remember one of the days I came in, it smelled like fish and chicken. And I'm like, man, like what is cooking? It was pretty strong. And then I asked the pharmacist, like, hey, like, what's that smell? And they're like, oh, we're compounding medication for a cat. So they have to add like certain flavors for the cat. And I just remember that smell was really strong, and I never forgot it, but it was pretty unique. Again, like I was volunteering there for some time, and I never saw them do compounding, but that was a cool experience. But yeah, I mean, when you have pets and they need medication, they have to try to find a way to get it compounded and make it easier for them to ingest. So again, certain pharmacies might do this, so it was a pretty good experience. And the main thing is for them to be adherent, right? You don't want to give patient medication and if they can't take it, it kind of beats the purpose, costs and waste and things like that. So compounding is really unique, and it could be a little pricey, I will say that for sure, but it's definitely a niche for a population out there. Prescribing, so this is a big one because most of pharmacists can't prescribe, especially history of pharmacy, but it's definitely changing a lot. So this is a big point to look into with pharmacists and prescribing. So now with pharmacists, if they collab with the physician, let's say like in a diabetic clinic or something like that, they can actually prescribe under the supervision of a physician. So that's pretty neat. That's changing a lot. Each state is different, but I know in California, it's definitely growing. So as long as there's some type of collaborative effort, pharmacists are starting to prescribe. I did see that when I was at Walgreens. When prescriptions would come in, we would always, recognize certain doctors, and I would see certain pharmacists' names starting to pop up more and more. And so you would always kind of see that collaborative growing. Outside of the collaborative effort, there is minimum prescribing that is starting to gain traction. One of the main ones that I did a lot, especially at Walgreens, was Narcan. Narcan is the opioid antidote, essentially. So for those that maybe have a overdose on like an opioid type of medication, Narcan is like a life-saving EpiPen for opioid, if that makes sense. So it's kind of like an EpiPen form for those that overdose to opioid. A lot of EMTs and paramedics will carry this, officers, firefighters, they're starting to carry this now, so as a saving agent. And with pharmacists, I know when I was at Walgreens, I would prescribe it to patients without having any consultation with the doctor. And so Walgreens had that effort to provide, because essentially what it is a patient is given, let's say, a certain number of opioid or pain medications. We as a pharmacist have to make a judgment to say, hey, you know what? This patient is at high risk for overdose. So even if they don't want to pick it up, I'm going to go ahead and write the prescription, prescribe it to them, educate about why they should have it, in their home. And if they don't want to take it, we store it on their file and we document that we educated and that we explain to the patient. So that way, later down the line, if something happens to the patient, it shows that you did your due diligence in providing this service. Because it's easy to just ask a doctor to prescribe. Sometimes a lot of doctors are busy. So as a pharmacist, if you're in a field where you're able to do it, why not, take advantage of the service? And if the patient doesn't want to take it home, at least you can document and you have it on file and to show that this is what you provided and the patient declined. So that was a big one that I did a lot. Birth control is starting to become more of a popular prescribing agent for a lot of patients. I didn't get to do this with Walgreens, but certain practices are starting to allow pharmacists to prescribe birth control, which is important because a lot of times doctors, again, are backed up. Patients are waiting on their refills, and it's really crucial with birth control to make sure they're taking it, appropriate on days and not have too many days missed. Travel medicine is a great one that I saw in certain independent pharmacies. So you have a pharmacy in the independent setting that's just run like any pharmacy, but then they'll have a certain area come where you have like a consultation, and the pharmacist will go over, where you decided to travel, what vaccines might be recommended, and this country might be high risk for this, so we recommend this. And sometimes they might be able to prescribe like antibiotics to help prevent. So that's a pretty cool practice that I've seen that's starting to grow as well. And then of course, smoking cessation is a big one that they're trying to push to give patients access to helping to quit smoking. So these are all examples of prescribing opportunities for a lot of pharmacists. And on top of this, you also have collaborative efforts. So as I mentioned before, pharmacy is growing. We're definitely starting to see the change in what we do. And so I feel like we're really underutilized, and we're slowly starting to gain some traction. And so the opportunities out there are growing. So I think it's good to know that. So that way, when you think of community pharmacy, you're not just thinking working behind a counter and doing the same thing over and over. Like, no, you're getting more involved now with patients and doctors and prescribing vaccines and et cetera, et cetera. So just good to keep in mind. So here's some statistics. So with community pharmacy, I would say about 50% of most pharmacists work in this field. So it's a big field, and it's definitely makes up the majority. I have here 60% work in outpatient, 50 in community. So I'll go a little bit what that 10% difference is. But yeah, I mean, more than half, I would say, work in this setting. So it's definitely a field that a lot of pharmacists are able to find jobs in. And I would say it's a little bit more easier to get just because of the number of pharmacies and settings that are available. Looking at, maybe the salary, I know something that people don't talk about or don't want to mention, but it's always in their mind. So I would say, in the community setting, you're looking about 125 to 130, which is generally what I'm kind of seeing right now in the field. I would say if you go more clinical, so let's say more like hospital, I definitely see an increase. So this is more based off like 2020 statistics. But yeah, outpatient makes up majority of pharmacy settings. Inpatient, which is 26%, more hospital based. Then you have industry. So industry is something I didn't mention, but this is more pharmaceutical, maybe research and development. And then 7% is others. So that could be like academia, teaching, things like that. So this is kind of a general breakdown that I try to make it easy for you to see. But yeah, like I said, community setting, outpatient, it makes up a majority. So it makes sense why most people that see pharmacists or pharmacy, they think of this type of setting. And, obviously there's more, but this is the majority. And this is a nice little chart that I made because I'm a visual person, so I'm trying to make it easy for you guys to see. So you have pharmacy, right? And then I talked about earlier, inpatient, outpatient. So looking at inpatient, hospital is the main setting. You also have something called nursing homes that makes up inpatient. Industry, so more research and development. And then on the right, you have others like academia. So now looking at outpatient, so this is kind of where we're focused on today. You have community setting. So as I mentioned, you have your chains, your retail, your independent, but then you have something in the clinics. So you have something called outpatient clinics that I'm going to go into detail of the different settings. And this is actually something that I'm working in right now. So the clinics I work at are not chain, they're not independent, they're not really retail, but they're more clinic based. But I'm not in a hospital though, so I'm still providing outpatient community pharmacy services. It's just more in a clinical setting, more clinic based. And I'll go over more into the different settings. But this is a nice little map that I made just to kind of help you guys see a little bit of the different settings. All right, so careers. So as I mentioned, chains, you have your CVS, your Walgreens, Rite Aid. If you want to get more specific, you have something called mass merchants. These are your Costco's, your Walmarts, your Targets. So all these have pharmacies as well. Then you have your supermarkets, Albertsons, Bonds, Safeway company essentially. And then you have your Ralph's. An independent, that's your family owns, as I mentioned before, more business or multiple businesses or business owners have control. So these are essentially all part of the community retail definition, as I talked about. A lot of benefits, as I mentioned before, also is location. So within 5 miles of your home, you probably have one of these located. So it's pretty easy to find a job within your area. If it's not saturated. So if it's a popular area, then of course it might be a little bit harder. Like myself, I had a hard time finding a local Walgreens or even CVS to work at. So that's why I took the opportunity to work in the desert. So yeah, the drive was not great, but you have to start somewhere, and that's something to keep in mind of as well. But most of the time, you'll be able to find a job. It just maybe not be always available in your area, but they are available there, but not maybe available for you. You need minimum experience. So again, I started working as a pharmacy student, and they hired me right away. And as I mentioned before too, having the patient interaction was one of my probably better qualities, I would say. So that was a big boost for me in working in this field. Downside, depending on the pharmacy you work for, it can be high volume, fast paced, so it could be a little stressful. It kind of goes hand in hand with patient interaction. You have also customer service, so it could be great, but then also could be the opposite. And then the hours too. A lot of these hours are pretty lengthy, so you can have pharmacies open from 8 to 9. Some could be like 8 to 7, and then you have others that are 24 hours. So you're pretty much able to work any of these times, which is great if you're looking for your hours. But if you're just trying to work like maybe the mornings or not trying to work weekends, then that's going to be a challenge, because a lot of these places are looking for night shifts or filling in last minute or working overnight or graveyards. So just to keep in mind, if you're looking to start somewhere, the chains, these mass merchants are good to get your foot in the door, but they have their own benefits and downsides as well. And then I would say this is probably the most common setting most people think of as pharmacy. I know for me, this is what I thought of pharmacy when I was an undergrad at Cal Poly. This was kind of it right here, like, oh, okay, this is kind of how pharmacy is if you want to work not in a hospital. But on the next slide, I'll talk about a lot more other options. So you have here is mail order. So Amazon, which is just growing like crazy right now, they have their own pharmacy services now called PillPack. And this is, again, an outpatient type of setting, but it's different because you're not, in a pharmacy where you're talking to patients all the time, but it might be more, telecommunication on the phone. So this is another option to work in. Insurances will have their own mail order as well. So pretty much mail order is insurance companies try to pack all your medications on the same day all together, and it gets shipped on a certain day of the month. So that way, when patients, get their mail, they have their medications delivered to them on a monthly basis, or sometimes it could be every 3 months, depending on the insurance company. So again, these are all considered outpatient kind of community settings, but it's a little bit non-traditional. But they're out there and they're definitely growing now, especially now with COVID. A lot of patients don't feel comfortable going in the pharmacy because of exposure. So they're turning to mail order and a lot of these services. Specialty pharmacies. So CVS and Walgreens actually have what they call specialty pharmacies. What they do is they focus on certain type of medications or maybe like injectables. And it could be like HIV or organ transplant medications. So a lot of these medications are expensive. They're not available at your local pharmacy. So they set up these specialty pharmacies so that way patients are able to get the medication that they need. And then of course they help with cost. They look at insurance and maybe they'll look at manufacturer coupons or discounts. And they just try to help patients get their medications at a good price, because out of pocket and cash price for these meds are ridiculously expensive. So again, specialty, it's considered outpatient. You're working in the community, but it's just not tradition to your regular retail pharmacy setting. Long-term care, so you have like rehab centers that they set up medications for patients that are in rehab. I know CVS has a couple of them. And then outpatient care centers is kind of where I'm working at now, if you would call it. So I work in a medical clinic, and in my setting, it's one building. I'm working pharmacy. To my right, you have medical. To the left, you have dental. And it's kind of like a circle. You have optometry, you have behavioral health, things like that. So we all work in the same building, and it's kind of more of a clinic. So that's, I would say, is more of my current pharmacy job right now. Hospital affiliate. So this is interesting because when you think of hospital, right, you're in a hospital that's inpatient. But I'm not sure if you guys ever noticed, but sometimes when you leave a hospital, you might see a pharmacy on the outside, maybe across the street or down the street that's affiliated with that hospital. And they have those because they want to make it convenient for patients that are getting prescriptions from that hospital. And let's say there's a Walgreens or CVS that's like 2-3 miles down, north or south. Sometimes these hospitals will have their own little hospitals, maybe on the first floor or maybe across the street. So these are still considered outpatient, community pharmacies. Again, they're not traditional, they're not your chains, but they're more affiliated with the hospital to provide outpatient services. So these jobs here, I would say, have a little bit better hours because they're more patient specific. So they target certain patients, population, or type of medications. Hours a little bit more, usually condensed to maybe Monday to Friday. I would say the pay is a little bit better because you're focusing more clinical now. So now you're working with a lot of clinical services here. A lot of phone, telecommunication, as I mentioned, specific population. Downside though, you definitely need some experience or residency. So in pharmacy school, you're not required to do residency. Residency is essentially additional schooling where you're working in the field to gain in a specific type of field. So if you go to like medical school, residency is required. In pharmacy school, it's not. And so, the benefits, obviously, if you do residency, you have a better chance of getting your foot into a specific type of field. The downside is that when you do residency, so let's say you graduate pharmacy school, you join residency, you're paying more money now for that program. So, you already paid a lot of money for pharmacy school, you have a lot of debt. Now you're doing more residency, more debt. But the upside is you're getting more experience and a better, I would say, up level for those that don't do residency who are trying to get a certain type of job. So again, it just depends on your track and what you want to do. But either you need experience or a residency to help you get more in these type of fields. So it's pretty highly competitive. And I think locations are more vague. So you're not going to see these on every corner like you do with the other retail chains. You might have like one location every 30, 40, maybe 50 miles sometimes. So that's another downside too. But just again, to be more familiar that pharmacy is more than just the retail setting, but you have also these non-retail traditional settings available for those that are interested. So the future of pharmacy, I've definitely seen a lot of growth just within the past 4 years as a pharmacist now. Again, as I mentioned before, vaccines, MTN, we're doing more clinical setting, prescribing and collaborating with other health professionals. So it's good to see the change in just a short span. I think COVID put a little stress on pharmacists as well. So again, it opened up opportunities, but also kind of put a little stress on the pharmacy field. But I think it's definitely growing in the right direction. But yeah, these are just some of the topics we talked about already. So I'm gonna go ahead and go to the next slide. So here again, the progression of growth, being underutilized, as I mentioned before, I think that there's a lot of back and forth with letting pharmacists do more. So it is a slow growth, but it's getting there. There is a shortage of physicians, and we're starting to see a shortage in nurses as well. So pharmacists are filling in a lot of those spots in providing care for patients. Technology is growing a lot too. So this is something that I know a lot of my older pharmacists that I work with don't like, but it's here though. I mean, technology is just taking over, everything, and so you have to obviously keep up to date with much as you can to be familiar with it, because it's whether you like it, it's taking over. Pharmacist burnout. So this is something that I read about the past year or two, and I can honestly relate to this as well. With COVID, it definitely put a lot of stress because we're providing all these services in our settings, which is great, but it's also taken a big toll on a lot of the pharmacists. So I know a lot of pharmacists who are feeling the effects, especially with the COVID pandemic. You see this too when nurses, nurses are kind of in and out of their settings for different reasons, but a lot of it could be burnout, a lot of it could be, choice, maybe they want to work from home. So I think it's good to know that, the community pharmacy setting is great, it's growing, there's a lot of opportunity, but you also have to be aware that, with more opportunity, responsibility, comes more, management and expectations. So I think that's a really important point to make. E-pharmacy, this is one that's starting to grow a lot as well. So pharmacy online. There are a little shady pharmacies online, so you have to be careful. But I think it's great that, if you can set a good, legit pharmacy online, I think that would be great for patients, especially because people don't want to go to pharmacies a lot anymore. They want everything online, they want everything fast and convenient. So as I mentioned with COVID, it really changed a lot for pharmacy, and I think just in healthcare in general. But I think as long as you have a mindset of the expectations of what's out there, and you put the pros and cons, and if it's right for you, I think there's a lot of opportunity out there for people. So in KGI, they had a pretty great foundation of integrating curriculum. So what we did a lot was we worked in team-based learning. So you work in groups constantly. You're put in groups, so you're learning with working with other people, whether it's on patients, whether it's on projects, presentations, things like that. And then on top of that, you're working with other health professionals. So we did a lot of collaboration with nurses, medical students as well. So you're already getting the experience and the knowledge from working or essentially collaborating with these individuals and students. So when you're working, it becomes second nature. So I think that's where they provide a lot of the communication skills, because you're constantly doing presentations, you're constantly, talking to other students and pharmacists and doctors and preceptors. And so it just builds your character and your skills. They have a lot of variety of careers. So as I mentioned before, I wasn't familiar with all the careers. I knew more retail and hospital. And then with the KGI, they essentially provided all these different fields where I got to go and did my rotations at a pharmaceutical company where I shadowed one of the pharmacists working there. They explained to me what they did, behind closed doors. I got to do hospitals, independent pharmacies, specialties. I got to do, I mean, just so many different kinds um, that exposed me. So I was able to know for sure what I wanted to do and what I didn't want to do based on my experience. And so we did a lot of rotations. One of my favorite things, though, I would say, is the community service and like local organization events. That's something that's always been kind of strong in my heart, was just providing those type of services or volunteer work. So kind of using all the skills, the education, the speaking skills, the knowledge, and then giving it back to the community. So, you know, I know for me, I gave back to a lot of the schools. I would educate students at my old elementary, junior high, high school. So that's something that I utilize a lot. I think us being part of the first class, I would say about 95% of us were involved in some type of organization, which was pretty awesome to see because we all really strive to do more than just learn and graduate. Most of us were involved in either leading some type of organization. Some of us were even starting up new organizations. And so it was like every weekend we had something going on and different students were starting. So you got to remember, we were the first class, so it's only us. There's no class above us. So we had to really innovate, be creative, and be ambitious. And I would say with KGI, they provided so many great opportunities for us. I would say back then too, our resources probably weren't the best. I can't even imagine how it is now, you know, with everything they have. But I mean, we made the most of it and we had a lot of fun, and I'm just so happy to see them grow. So that's the KGI impact for me personally. And then here are some of the certificates. So when you graduate from pharmacy school for KGI, you have an emphasis. So MTO, which is what I chose to do, that's the medication therapy outcomes. So that's more like MTM focus, so medication management, you know, making sure patients are on medications and keeping them from the hospital. Healthcare management is more focused on managing. Informatics is more technology based, and then clinical affairs. This one is more focused towards maybe like research and development or pharmaceutical. So again, the program is tailored to your area of focus. So even though you're all getting a degree in pharmacy, you get to have these classes focus on your area that you know are deciding to kind of go into. And it is a 4-year program, so it's definitely a commitment. But it was a great experience and a great program. So in summary, we kind of talked about community versus retail versus outpatient. Pharmacists do make up majority of workforce in the community setting. So we are evolving, but I feel like we're still underutilized. You want to make sure you're tailoring your personal goals with your career goals. That's something that I hear a lot of older pharmacists tell me, you know, like, hey, you know, when deciding to choose a career or a company or field, whether it's pharmacy or not, you want to make sure you know your personal goals and your career goals, and you know, making sure they're able to align somewhat, so that way, you know, you're not surprised and having to, you know, move across the state or anything like that. KGI prepared us for any pharmacy setting, as I mentioned, so they gave us an insight of all the different settings. And I think it's safe to say that we're trying to focus more on the patient, not the product. I think before, with all these chain pharmacies, they try to push products and, you know, numbers, and we understand it's a business, but we're starting to see that, you know, we got to focus more on the patient for their health. And then for me personally, it was just important in serving the underserved community. So I kind of utilize all these different skills and traits and education. And I've always wanted to serve the underserved communities. And at my current job now, you know, we provide services for the Native American community. So I'm happy to, you know, continue doing this as I was doing in school. So with that being said, here are just my references that I use for today. And any questions? I know that was kind of long. Hopefully I didn't go over, but any questions?
And also just as a note for everyone, you do not go over, so that's good. We have a few minutes left. But if anyone wants to, if you don't want to speak, you can always put your questions in the chat, either send them to everyone, or you can send them like to me directly if you want me to read them for you. Yeah, so we have like maybe like 2 more minutes. People have questions. Oh, I see we have a hand raised. Wendy, go for it.
Hi, Jesse. Thank you so much for your presentation. I learned so much from like all of the different options that you have as a pharmacist. I'm just curious because I have a cousin who's a pharmacist, and it seems like the burnout was way before the pandemic. Like pharmacists just are pulled in so many different directions, and it seems like they're so short staffed, especially in those community settings. Why do you think that is, and why can't they do something about that? Because it just always seems that our pharmacists are so exhausted. What's going on there?
No, that's a great question, Wendy. You know what? I probably would say it did start probably before I even entered pharmacy school. When I started pharmacy school, you know, I was probably 28, 29. And I think my mindset at the time was just work, 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 right? I didn't care where I went, what I had to do, what hours. Taking a look back now, you're right. It started way before. And a lot of these pharmacists who are older told me the same thing, you know, 10 years ago, whatever, 5, 15, they start to see a lot of change. From talking to a lot of the pharmacists, what I'm getting is a lot of the corporation, like the chains, are focusing a lot on the numbers. So what they're doing is they're trying to squeeze, minimize as many techs or pharmacists on duty while trying to capture the numbers. And, you know, that's something that I started to see a lot. And I didn't mention this in the presentation, but that was one of the reasons why I started looking outside of the chain pharmacies, because I started to feel like I was putting patient risk, you know, their health at risk. And so I didn't like that feeling. I felt like you said, I was being pulled in different directions. I was being told to do this, do this, do that. And again, I'm ambitious, I'm young, like I'm doing everything. But yeah, when you come home, it's a burnout. And, you know, I'm in my early 30s now, and I can't imagine doing this for 10, 15, 20 years, feeling like that every day. But to answer your question, I would say it's definitely something from, you know, the top, I would say. Because even if I talk to like the store manager, pharmacy manager, district manager, their hands are all tied. Like they can even see it in their eyes. Like, man, like I wish I could help you, Jesse. But
Right.
like it's so sad, but I can just see it in their eyes. And it's like, you know, I don't take it personal. I understand, you know, they have a job to do, they have a family. But it's like, yeah, you're right. I've seen it. A lot of older pharmacists have told me the same thing. It's happened before. I think with COVID, it just put the cherry on top.
Oh my gosh, yeah. I can't even
like,
imagine. It's just to be able, it's just mind blowing. It's mind blowing. And I guess part of it, I'm wondering if part of it is because you all, I don't know, you all, yeah, I just think you all are overworked. I mean, all the communication that you're doing to help people understand what they're doing to their bodies and how it's affecting other medications. And, you know, I think it's just a stressful job that we all just don't think about how stressful it really is for you all. So anyway, thank you so much for your presentation, and thanks for being a pharmacist.
Oh, thank you, Marnie. Appreciate it.
Yeah, so that is the end of our time. Sorry if anyone else had questions. I know some people are starting to leave already, but for anyone else who's still here, thank you so much for attending today. Thank you, Jesse, for presenting. That was awesome. And yeah, hopefully we'll see some of you guys back at another speaker presentation one day.
And then Hayden, I had a question.
Yeah.
If anyone ever wants to reach out, or maybe they didn't get a chance to ask, you can always provide them my email, and I'm okay if they want to reach out to me or anything like that. So just in case.
Yeah, for sure. I think sometimes people email us like just to admissions. So I can,
Okay.
if anyone asks, I will definitely hand that out.
All right, sounds good. Thank you, Hayden. I appreciate it.